In today's video, we're going over the best soft tissue strategies for folks with neck pain. So Chang in 2014 did a systematic review looking at massage for the treatment for patients that had neck pain. And what they found was that generally in the immediate term, so basically right after performing the massage, folks felt better than doing nothing. So in this video, I'm going to talk through my favorite soft tissue strategies for folks that have neck pain. So first we're going to target the upper trapezius, mid trapezius, as well as the lower trapezius, and the rhomboids, and we're also going to catch the levator scapulae too as it runs up here. First we're going to start with the cup. All we do is squeeze the cup, apply it to the skin, and this is a sliding technique. So I just slide throughout these tissues here, going up and down. You can get a little bit more towards the neck if you like, and just work on the tissues you feel are most involved in your patient's pain. Generally speaking, when I'm working with patients, I'll ask a lot of questions about which areas they feel are involved, and I'll spend more time on those particularly tender or sensitive tissues. So from here, I can introduce a tool. What I can do is anchor down the cup, and I can use the tool to push away from the anchor. I can do this in both directions, obviously, right? Back and forth. Move the cup, use the tool, move the cup, use the tool, and I can obviously do this in a variety of different positions, just like so, okay? I also really like to use my hands during this intervention. If you have a lot of lotion, then your hand will slide a lot and you'll get less of an effect. So I generally take off some lotion for this reason. I'm using my fist, starting in the thoracic paraspinals, pushing down and coming off the edge, basically turning 90 degrees to the left. Once I get to the scapula, turn the corner and go through the upper trapezius just like so. And usually I'll do somewhere between 5 and 10 passes from here, okay? We can also try some ischemic compression. So basically if there's a particular super tender area, a lot of folks will say, you know what, it kills right here where levator scapulae attaches to the scapula, or they'll say, you know, in my upper trapezius, I have this knot right in this area. One of the things you can do is you can apply some pressure. I generally use a towel just because it makes me stick to the muscle a little bit better. So let's say that I found kind of this knot right here and the patient says, yes, that feels just like my pain. What I can do is apply pressure directly down in that area and hold that for around 45 seconds or so, or until I feel that area kind of softening underneath of my fingers, all right? The last thing you can try is if you have a knot that's really painful, the patient says, yeah, that's my pain right in this area, you can also apply a little bit of a cross friction massage on that. Just keep in mind this is a little bit more of an aggressive treatment. So let's say I'm rolling over top of the muscle and I feel that slide right underneath my fingers. I might go onto that muscle and then just try to go back and forth over top of it. And again, somewhere between 30 or 60 seconds or until I feel that muscle loosening underneath my fingertips. Another good strategy for the upper trapezius is to roll through the trapezius for 2 repetitions. And then on the 3rd repetition, you want to try to go firm pressure up onto the like button and subscribe to the channel for fitness pain free. Next movements are going to be in sitting. So we're going to have Mike just sitting nice and upright here. I'm going to use the trusty handlebars, okay? And the first set of muscles we're going to work on are going to be the upper trapezius, a little bit of the levator scapulae. Very easy to access from this position. So from here, I just want to make sure I'm not just pushing up and down on the scapula, on any bony prominences, because that obviously doesn't feel great, but I can work very easily along the upper trapezius up to the base of the neck. I can go a little bit further down, so maybe I'm starting to catch a little bit of the middle trapezius. If I want to do a little bit more of the middle and lower trapezius, I can have Mike slouch for me. You go ahead and put your elbows down on towards your knees, and you can see how this opens up this area, so I can take my tool now and just run through here. Just be careful, your spinous processes are right through here. I don't want to try to start bumping over top of those. It's not going to feel too good for your patient, all right? Let's say we sit up nice and upright again. If I want to try to work a little bit into the upper trapezius as it goes towards the head and a little bit of the scalenes, I can actually have Mike side bend, so get your ear, closer to your shoulder on this side. He's also rotated, which is nice. So I can go a little bit further up on the side of the neck through here. Just make sure you're not applying too much pressure because that'll be forcing your patient's neck to the side. Sometimes they have a painful neck. Obviously, it's not going to feel phenomenal. Next, we're going to use a dummy thumb strategy. So essentially, my thumb is going to be helping me with the mobilization, but my opposite side arm is going to be applying the force. This helps to save your thumb so you don't hurt over the course of time. So largely what I'm going to do is take my finger and place it, I'm on the upper trapezius, I'm going down towards where the levator scapulae attaches. And whenever Mike feels the pressure of my thumb straight down, I'm going to instruct him to turn his head towards the right and bring his chin down. And as he does this, I'm going to slide my thumb along those muscles all the way down to the scapula, okay? I can also use more of my body weight pretty easily. So I'm gonna stand up. And again, Mike, once you feel my pressure, I'm just gonna slide all the way down. Yep, towards the scapula, okay? Now, if I wanna try to target a little more of the upper trapezius as it goes to the shoulder, I can do the same idea, except now I just want you to bend your head directly to the side. You ready, Mike? So he feels my pressure and he starts bending towards the side, all the way down. And what's nice about this strategy is that Mike can actually go as fast or as slow as he likes. If he goes really quick, it can be pretty painful. If he wants to slow things down a little bit, usually he can feel a bit better while he's doing it and have a little bit of control over the amount of pressure. And the last intervention that we can apply to the traps, but also the thoracic paraspinals, is gonna be the same idea with a little bit of motion. I'm gonna use my fist just like so. And then when Mike feels my pressure coming straight down, I'm gonna instruct him to slouch, yep, and reach his elbows down towards his knees. And I can just go down as far as I feel like I need to. So coming back up again, once you feel my pressure, go ahead and start to slouch. And just go down, 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 down.
And now I've got a free guide for you today. It's an evidence-based cheat sheet to cervical radiculopathy. We go over all the fundamental basics for diagnosis and treatment of cervical radiculopathy. It's an 8-page PDF, and I'll take you from a novice to an expert extremely quickly. I'm gonna leave a link in the description, so you can go ahead and download that right now and get learning.
We can also pretty easily use the handlebars on the side of the neck. So now we're probably trying to target the scalenes a little bit more. So I'm gonna take my tool right here, make sure you have some lotion on the neck. And I'm just gonna work my way lightly from the base of the neck up towards the top of the skull by the mastoid process. Just keep in mind, you probably wanna keep this pressure a little bit lighter at first. Pushing on the side of someone's neck can sometimes be a little bit uncomfortable. And most folks, once you start to mess with their neck, it's a weird new sensation. So if you're working with a patient for the first time, I just wouldn't be aggressive with this. If you want to try to get a little bit more of the posterior scalene, I can angle back towards me. If I want to go a little bit more anterior or middle, I can actually angle the other direction, okay? Just keep in mind, once you start getting side front of the neck, a lot of patients don't like that sensation. So start slowly and just ask a lot of questions to make sure the patient's comfortable. We can also treat these scalenes as well as the SCM in supine. So basically, I'm gonna take my hands underneath the Mike's head, and from here, I'm gonna find my scalenes, pretty easy, right in the side of the neck. And I can do a few things. So one, I can just push down and slide, okay, which I am working on the scalenes directly. I can also shorten the muscles a little bit by side bending, press into the scalenes at the top, and then slide as we side bend, right? Just keep in mind, this is pretty tough on the thumbs, so I would use a variety of different interventions and make sure your thumbs aren't killing you over the course of time. We can apply the same idea for the SCM. So the SCM attaches up here by the mastoid process and comes down towards the front. And if I rotate towards the involved side here with this SCM, I'm lengthening it, right? So relax your head as best you can, Mike. From here, I'm gonna start at the top of the SCM, and I'm gonna start to rotate the head, slide down the SCM towards the sternum. Do keep in mind, again, you're working with patients in front of the neck, so make sure you go easy at first, and over the course of time, you can apply a little more pressure. So again, starting right here, applying my pressure, rotating towards the side, and working down the SCM. From this position, I can also work the cervical spine paraspinals. I generally like to use a towel, just because it helps my fingers stick to the muscle a little bit. I'm going to go underneath of the neck, apply some pressure, and then draw small circles. You can basically work on whatever level you feel is most involved. So let's have you relax your head here, Mike. Very good. What I'm doing is finding the cervical paraspinals. So in the center of the spinous process, move over to the side. You'll feel them. They're meaty. They pop in your fingers. From here, I just draw small circles. I can start lower, and I can work my way up higher and higher, all the way up towards the top. And the last strategy we can use at the very top will be working the suboccipitals. So I can take my fingers and try to get them all to be level here, and they go under the base of the skull right here. And Mike, take a big breath in, and when you blow out, try to relax your head as much as possible, nice heavy head. And the idea is my fingers are sinking into those suboccipitals every time he breathes out. Now this is also a little tough on your fingers as a therapist, so you can take your handy handlebars, go ahead and pick the head up here. I'm not gonna bash you, I promise. And you can actually take the tool and go ahead and relax your head and try to find the patient's suboccipitals. And then every time you exhale, nice heavy head. And you can utilize the tool in order to be your fingers, which is a whole lot easier on your hands as a physical therapist. All right, a couple thoughts. So this study by Chang in 2014 showed that in the immediate term, so basically right after you do these massage techniques, people felt better. However, if you compare that with exercise, exercise did the same thing. And they also found that when these studies were including manual techniques like joint mobilizations, they actually tended to perform a little bit better. So at the end of the day, Little sad for the research on soft tissue work like massage. With that being said, if you have a patient that has neck pain, of course apply an exercise program, apply some manual techniques, and you can use a combination of soft tissue strategies and joint mobilizations. I think at the end of the day, you're using whatever works best for your patient, but do keep in mind it's not mandatory to do soft tissue techniques for your patients, right? Let me know in the comments what you guys think. Do you like soft tissue strategies for the neck? All right, so now you know some great soft tissue strategies for patients with neck pain. You still need some exercises. That should form the foundation of your treatment strategy for these folks. So I have an exercise video for you in the corner. Why don't you go ahead and click on that, and I'll see you on that video.